As you study the relevance of the anatomy and physiology of the hypothalamus-pituitary-and-endocrine glands, it's absolutely crucial to understand how the hormones will talk basically back to these master glands of the hypothalamus and the pituitary via various feedback mechanisms. One of those mechanisms, it's the predominant one, is called negative feedback that allows in a servo-regulatory way for very constant levels of hormone to be maintained in many cases. In some cases, we also see positive feedback, and you can see that the red lines will indicate negative feedback, and the green lines on the graphs I'm going to show you going forward will show positive feedback. Most of the clinically relevant and detectable mechanisms are negative feedback, however. So as we go through the normal negative feedback systems in the hypothalamic-pituitary-endocrine gland axes, and we look at 6 abnormal conditions of hypofunction and then hyperfunction, I encourage you to perhaps stop and look at the text and after having listened to what I had to say and see if it makes sense to you. Or review at the end, because I think some of these concepts will take a little time for you to incorporate. Having done so, I think you'll be in very good shape to understand endocrine pathophysiology and diagnostic testing. So in this module, we're going to talk about very basic paradigms of how the hormones interact with these glands and create this servo-regulatory system. And in all the cases, we're going to use the same sort of cartoon to explain these. Hormones will be shown as H, the trophic hormone. That would be something such as thyrotrophic hormone, follicle-stimulating hormone, etc. That will be called TH. And the releasing hormone produced by the hypothalamus, such as thyrotropic releasing hormone or gonadotropic releasing hormone, are going to be called RH. We'll show specific examples later as it relates to the impact of understanding these systems on diagnosing and on the pathophysiology of certain diseases, but we're going to use the same indicators of these particular levels of the system. We also are going to show in red will be the negative feedback systems. A full line will indicate strong negative feedback, and a line that may be dotted will be showing us something that is less than full feedback. Just to be complete, the green line will indicate positive feedback. We occasionally see such systems, for instance, in the ovarian system, where the hormone will feed back to the pituitary in a positive way, such as estrogen, for example. But we will not spend a lot of time on these kinds of mechanisms, focusing most of our attention on negative feedback going forward. So let's take a look at what we call the euthyroid or euadrenal or eugonadal system. That is the normal negative feedback functioning in a healthy animal. And so all we've done here is to denote that we're showing here what the levels are of the releasing hormone, trophic hormone, and the effect on the target tissue. And all we can say is that most of the time, what can we measure? We can measure sometimes the trophic hormone and the hormone, and occasionally we can clearly measure the effect. That would be the clinical outcome of the action of the hormone, but quantifying that may be more difficult than measuring a hormone in the circulation. And so we're showing here that these are all in balance. They're all talking to each other still, and the system is ready for there to be feedback from usually of a hormone, not only on the pituitary, but also on the hypothalamus. And we need to keep this in mind when we change that system and understand that both the hypothalamus and the pituitary, if you need it to come back to normal, both have to come back to normal after a perturbation, let's say by an exogenous administration of a hormone. Now let's turn to perhaps the most common and yet simplest form of perturbation of the hypothalamic-pituitary glandular axis, and that would be failure of the glands. So that's denoted here by these X's Xing out the glands. And what are the scenarios where we see this perturbation? Well, we can see it when we remove the glands surgically, or when there is, say, an immune-mediated destruction of the gland. But regardless, let's take a look at what happens. Firstly, it makes sense that the hormone levels will be low. And then it will make sense that the animal will become, and that's why they may be presented to us, either hypothyroid, hypoadrenal, or hypogonadal. And so this will lead to some clinical effect that means there's a clinical problem for the animal. However, what happens at higher levels is that because we're lacking this negative feedback, notice the dotted lines. There's weak negative feedback because of low hormonal levels. We see that this results in a larger amount of the production of the trophic hormone, so those levels are high, and a larger amount of the releasing hormone, and those levels are high. Now, usually we can clinically measure, if anything, we can measure the trophic hormone, but not the releasing hormone, because if you might recall, the releasing hormone is produced in the hypothalamic-pituitary portal system that isn't accessible via a venipuncture, for example. So very special studies have had to be done to understand that system. But the clinically relevant thing here is that you can first see that first you're presented with an animal that has signs of deficiency. You measure the hormone or some indicator of the hormone. Usually we talk about it being the unbound hormone when it's a steroid or thyroid hormone. The unbound hormone is going to be low. And the response of the pituitary, because all it knows is what it's getting as feedback, negative feedback, that the negative feedback is too low. The response of the pituitary is to try to make more hormone by creating the stimulating hormone or the trophic hormone. And so a diagnostic measure of a low hormone or free hormone and a high trophic hormone would be an indicator of, a classical indication of primary glandular hypofunction. Let's turn to a similar but slightly different situation, and that is where we don't have a gland that's actually been physically damaged, removed or damaged, but we have a gland that has had its ability to produce hormone reduced, either due to some blockage of the enzymes that normally create the hormone, or due to a nutrient that's missing. We see this with iodine deficiency, for example, producing thyroid hormone. Either one of the circumstances will lead to a blockage of hormone production, and that's represented by these blocks. And the hormone level will be low, and of course the animal presents with low hormonal effects and hypofunction of that gland. So what happens in this case? Well, again, due to the same mechanisms, we get high levels of a trophic hormone and high levels of releasing hormone. But in this case, we may not find a small or shrunken gland. We may find an enlarged gland. And in this case, the reason is because that the trophic hormone levels are high, and we are seeing this effect on the glands and leading the normal tissue that's just either inhibited from producing the hormone is still responding with the other effect of the trophic hormone. Trophism means growth, and so you'll see growth of this tissue, and therefore an enlargement of the gland itself. And so an example of this would be iodine deficiency, lack of thyroid hormone production, elevation of TSH, and goiter, or enlargement of the glands. And this would be this, what we call DisHormonal Genesis. Let's now take a look at what we call secondary, or that means pituitary hypofunction. Examples of this are you have primary failure or lack of development of the pituitary. That's a rare condition in animals at least, and or drugs that can suppress pituitary function. And also you can see this occurring when there's been a surgical removal or cancerous mass perhaps damaging the pituitary, and also occasionally with trauma to the pituitary. So what happens here? We have the situation where the primary problem exists at the pituitary, and so it cannot produce the trophic hormones. You see they're low. And so as a result, we have the lack of glandular stimulation, we have the lack of glandular hormone production, and therefore the hormone levels are low, and the animal presents with hypofunction. What would be the negative feedback in theory, although we almost never can measure this directly, is that in theory we would have a high releasing hormone because the negative feedback from the pituitary to the hypothalamus is low, and you can see that from the lack of negative feedback to the hypothalamus. So this is a situation, again we call it secondary pituitary hypofunction, leads to the primary problem, if you will, is a secondary level, which means pituitary damage or inhibition, and as a result it feeds through the system. We have small glands, low amounts of hormone, and low hormonal effects. Now I'd like to take a look at the situation of what we call iatrogenic feedback as a result of giving an exogenous hormone that impacts this particular hypothalamic-pituitary gonadal or thyroid or adrenal axis. And I listed one clear example that happens all the time in clinical practice, and that is the administration of glucocorticoids and their suppression on the hypothalamic-pituitary-adrenal axis. So we're going to call the exogenous hormone EH, as shown here. And you can see that the first thing that's going to happen is that you're going to have a large effect on the hormone target tissue, and that's what your goal is usually when you use these drugs clinically. And so, but let's look at what happens to the endogenous systems. There's inhibition, very strong negative feedback at both the pituitary and the hypothalamic levels, and as a result, we get a lowering of the releasing hormone, which we usually don't measure. We can oftentimes see a lowering of the trophic hormone, and of course a lowering of the endogenous hormone. We often will use this system for diagnostic purposes, which we'll discuss later, such as a low-dose dexamethasone suppression test, where we're trying to show that the system works normally. Let's take a look at what happens if you remove, as a clinician, remove the exogenous hormone, leaving this system out of balance. You would have an animal that would have a low hormone level, low trophic hormone levels, and potentially atrophied primary glands, so not able to respond with the production of their own endogenous hormone levels. And this is what we become concerned with over too rapid withdrawal of an exogenous hormone and resulting in a hypoglandular state as a result. Our final two scenarios, this being the first, would be hyperfunction of the gland. And we're going to talk first about autonomous or primary hyperfunction of the gland. And we see this with functional thyroid and adrenal tumors. So very clearly, the problem starts with one or both glands, usually one being growing and producing hormone in excess, and that leads to very large amounts of negative feedback at the pituitary and the hypothalamus, and therefore low releasing hormone and low trophic hormone with high endogenous hormones and of course high effect. So what would one do to use this system in a diagnostic sense? You could see that the hormonal levels are first of all elevated and measure the trophic hormone. So if you found that in fact you were concerned that there was a pituitary problem and found the trophic hormone level to be low, that would suggest that that negative feedback system is operating properly as the trophic hormone levels are low. So that would point you back to the primary gland. And we'll talk about in the next scenario where the problem exists at a higher level, particularly at the pituitary. Okay, let's take a look at the final scenario of secondary or pituitary hyperfunction. And this is where there's an overfunction of the pituitary, such as a tumor, an adenoma, or carcinoma, or the possibility that there is an insensitivity, as shown here, of negative feedback at either the hypothalamic or pituitary level. As a result, we find, of course, that the pituitary trophic hormone is elevated if it's a problem of the pituitary feedback or a problem of a tumor, leading, of course, to the hormone being elevated due to hypertrophy of the glands. In this case, we would see bilateral hypertrophy of the glands, and due to the trophic hormone producing its growth-stimulating effect. And, of course, the end effect on the hormone target tissue in the clinical presentation would be associated with an elevation of the hormone. Now, an example of this, very common example, is canine hyperadrenocorticism, where in fact it is believed there may be some altered sensitivity of the pituitary and or hypothalamus to the negative feedback, leading to bilateral hyperplasia. In this scenario, we test by administering exogenous glucocorticoid to see if, in fact, you can or cannot suppress the endogenous cortisol level. So we would give dexamethasone, and presumably via ACTH being suppressed, we would then, in a normal animal, see lowering of cortisol. In an animal that has an abnormality of this disorder, there'd be some either intermediate or complete lack of suppression by the pituitary, of the pituitary, and therefore of endogenous cortisol as the sort of proxy for ACTH in this case. If we were to measure ACTH directly, that trophic hormone, it too should be suppressed in a normal animal. So, in summary, in this unit, we've taken a look at the primarily negative feedback systems of the hypothalamic-pituitary endocrine glandular axis, and have looked at clinical scenarios, both be a normal situation and 6 abnormal situations associated with hypofunction or hyperfunction of endocrine organs.